We're going to be talking a lot throughout the month of February, I'm sure, about the fact that it is Heart Month. And truthfully, we can't talk about it enough because all of us face concerns and risks probably about developing heart disease at some point in our lives. This is Dr. Matt Wiesenen. He is the director of the Cath Lab and Structural Technology at Centennial Heart at Parkridge. Good to see you.
Good to see you.
That Centennial Heart might be a little bit new to people. That's a fairly new way to call your team of cardiologists there at the hospital, but the caliber of care at Parkridge is certainly not anything new to folks. And it all begins, I guess, Matt, with that desire to see your patient as the individual they are.
We really have been fortunate enough in that we've coalesced a group of what I consider to be some of the top-rated specialists, heart failure, imaging, interventional electrophysiology. We've really coalesced this partnership of members together to, I think, really take exceptional care of our patients. And it's been a few years in the making now, but I think we're really coming together and have a really outstanding group.
When I made the comment about we can't talk about it enough, it's because it's actually very complex. The heart is complex,
yes, ma'am.
Which means that anything to do with it is going to be not the same thing for two different people. So many of us think about the widowmaker heart attack. I hate to be that blunt.
Yes, ma'am.
But often it can be very subtle.
It can, and you know, everybody's symptoms are a little bit different. In the old classic teaching where somebody was having the chest pain and it radiated into the left arm and to the neck isn't the way it is for everybody. And so understanding what the symptoms are, whether that's shortness of breath or nausea or just a little pressure or tightness in the chest, and then really the importance of understanding and knowing your risk factors to try to prevent getting to that point to begin with is something that we really try to emphasize in our practice.
Is it true or false that men and women have different symptoms of a heart attack?
It's true that they have different symptoms, and everybody's a little bit different. You'll see some men come in with very subtle symptoms, and you'll see some women coming in with the very classic symptoms. But at the same time, more women are presenting with those atypical symptoms, and so sometimes it's harder to nail down. And so it really, what I tell people is there's no shame in getting checked out if you have a concern. Anything that may be subtle sometimes requires some diagnostic testing to make sure that it is or is not the heart that's causing the problem.
You began by talking about the strength of your team. You had told me before we started that you do not require a referral from a physician. People can self-refer. So when they call in, which they can do, to make that appointment, is it important that they might mention any issues they're currently having to get to the right member of that team?
It does help. You know, obviously we all have our subspecialized areas within that, but we're all at the heart of it, pun intended, I guess, we're all general cardiologists. And so we'll all kind of work together to figure out and track that person to the appropriate person, whether it's a heart rhythm issue, whether it's coronary artery disease or heart failure. We really have the team around and we all work in the same space to really try to simplify the care for the patients as they come through.
I tell this story frequently, so forgive, here I go again, it'll be new to you. But my father died 40 years ago from a heart attack. 40 years ago, open heart surgery, bypass surgery was the new thing. So I use that to say how far we have come now. You mentioned to me that y'all are doing some kind of specific work right now with valve issues. Are you excited about what you're seeing?
We're seeing just a tremendous growth in the area of sort of the minimally invasive replacement of heart valves or repair of heart valves. And we've been you know, bringing this to the forefront at Parkridge now for the last several years since I've been there. And even when I came to Chattanooga years ago and working on mitral valve issues, aortic valve issues, repair of structures of the heart, I oftentimes joke a little bit that, you know, as much of an advent of cardiac surgery was years ago, we're now getting into the era where we're not necessarily going to be replacing the cardiac surgeons, but the cardiac surgery is becoming less of the first option and more of the backup option if the first line options now aren't working well. If we do a minimally invasive approach and suddenly we need to move on to something different.
Got a couple of minutes left. Prevention certainly is, I'm sure, what you're always after. We are in the stroke belt, and stroke and heart disease are not too far separated. So give us kind of that 101 on some things to keep in mind to keep us as healthy as possible.
Well, in this area in particular, I think the first thing that we really focus on is our diet. And we know that our diet in the South is not as good as it ought to be with regard to health. And so we look at things that are, foods that are high in fat and high in cholesterol, and the deep fried foods and foods that are high in sodium. Those are all things that we should try to cut back, if not eliminate altogether. And then the other things that we look at are smoking. And smoking is really still a relatively prevalent problem in this part of the country, and so those are relatively easy things to target and then try to work on to reduce our risk. But then what I am really trying to encourage my patients is know your numbers, know your cholesterol, know your blood pressure, know your blood sugars. Those are all things that not only will help reduce your chances of heart disease, but also reduce your chances of stroke and other arterial problems throughout the entire body.
Well, so on that know your numbers topic, I'll segue into yours.
Yes, ma'am.
Here is how you can reach them. It's Centennial Heart at Parkridge, but parkridgehealth.com is going to be the website if you want to go and learn more about the program that they have there. But that phone number is 508-6733. If you currently have a general primary doctor and you want them to refer you that way, feel free, but it's not required. You
Yes,
can
ma'am.
self-refer if you wish. Thanks so much.
Thank you.
Feels good to be home.
Ashley's President's Day sale is going on now. Hot buys are up to 50% off starting at just